Hello, I'm Dolly Curtis, and today it is with pleasure that I'm going to introduce you to Dr. Kenneth Liegner in Armonk, New York. Dr. Liegner is a person who's specializing in treating people with Lyme disease, and there are many people in our area who have Lyme disease, and I am one of them. And it's with much importance to me that we talk about this today, because I'd like to share it with the audience and ask Dr. Liegner as many questions as I can in the next 30 minutes so that we can all be aware and educated to Lyme disease. Hi, Dr. Liegner.
Hi, Dolly. Again, I want to thank you for inviting me to be on your program.
I think it's really important that we just start, even though everybody is fairly familiar with Lyme disease because they're being bombarded with the information now. Almost everybody must know somebody that has Lyme disease at this point. We better just start with what it is and why there's so much of a problem with Lyme disease, and then maybe we can get into more of the more complicated parts to the disease.
Okay. Well, basically, I think most people realize that Lyme disease, number one, is an infectious disease. It's an infectious disease that far and away is transmitted through the bite of an infected tick.
Well, it's just so hard to believe that something that minute, small, tiny, and it's the nymphal tick, the tiniest one, really, isn't it, that does much of the damage?
Well, both the nymphal tick, which is very tiny, maybe the size of a sesame seed, and also the adult female also does transmit. Both of them transmit the disease. The larvae, which are like grains of sand, fortunately for all of us, is not involved in transmission of disease. If it were, we'd really be in trouble, because if you think the nymphs are small, the larvae are just tiny dots.
Now, in Westchester County, which is where you are, and I'm in Fairfield County, there seems to be an endemic problem with Lyme disease, which is true, right?
Yes,
we have to start with that as an assumption.
Well, there's no question about it. The CDC has been in this area and doing dragging for ticks, and they've said you've got a heck of a problem because there are ticks all over the place.
Now, I live in a little town, Easton, Connecticut, and you visited us and come and spoken to our support group. We do have support groups that we should mention all over the area that will help people, referral to doctors, and just general help and support, moral support, as well as educational information. In the support group, when you came to visit us to Easton, you know that we have about 40% of our town is woodlands. And we have a very large deer population, and we have lots of field mice and birds and rodents and all the things that seem to be carrying this disease.
Right. There was a beautiful drive coming up to Easton. What's that road?
Route 136.
It was gorgeous in the dense pine forests.
Right. About 40% of our town is watershed for Bridgeport area. So that is one of the reasons a lot of people have moved there, Dr. Liegner. I call this the suburban nightmare, Lyme disease, because people have moved into these areas because they want the quiet, the country, the peacefulness, and now we find ourselves living amongst an endemic problem that we've sort of brought on ourselves. In a way, nature's gone askew or something here.
I think that's a very good point that you raise. One of the reasons why Lyme disease is such a problem is you take people and put them in an environment where they have very close contact with nature. A lot of people in this area, as you said, moved here so that they could have some property. A lot of times the zoning is, 1, 2, and higher acre zoning, and that is conducive to wildlife. And the deer population has tremendously increased over the last 40 years or so. And we know that deer have a very important role in amplifying deer tick populations. So you take tremendous increase in deer ticks, and people who are living in these areas where all you have to do is step out onto your front lawn or adjacent woods, and your chances of encountering an infected deer tick are very, very high.
But I mean, people don't believe me. I tell people that you're really in danger when you're just barbecuing in your back area with your, especially little children, Dr. Liegner. They're out playing in the grass. They're closer to the ground, and the ticks, they crawl, right? They don't fly, so they start.
Right. They don't drop from trees. As far as we know, they start pretty low on the ground. They're either on blades of grass or low-lying vegetation, and then when a person brushes by, they grab onto either the clothing or the skin and then seek a place to feed. And I think it is a very serious problem, especially for children.
That's what I'm thinking.
And I think your comment that it's hard to believe that something that this tiny could cause a serious problem is a true perception. And I mean, it is incredible. I have thinking of one large construction worker patient of mine who was a robust man, and he had a Lyme rash a number of years back, which he didn't even recognize was a Lyme rash, and as a result did not seek any medical care, and then subsequently became very, very ill, and even now is still on disability and unable to work. It's just hard to believe that something so tiny could...
well, there seems to be a denial going on here, and I really am one of the people that practiced a little bit of that denial. Just people can't really seem to accept the fact that something so tiny, that's so prevalent, that's in our everyday lives, on our dogs and our cats, that go in and out. I mean, I still have my cat, and it still goes in and out. You know, we still hug it and pet it, and it still jumps on the furniture. Now, that cat doesn't mean any harm, but it could have a tick on it very easily. I mean, I've often taken them out of the cat's eyes.
Yes.
Now, that little tick had made me so ill that I've almost lost most of the last 2 years. So,
it is recognized that pet ownership is a risk factor. That not that the disease is transmitted by the pet, but that if a tick is on the coat of an animal and has not yet fed, it may wander off the animal's coat onto furniture or bedding, and then onto a person.
Will it live if it's in a house?
It can live probably for a couple of days.
Oh, really?
The ticks are very sensitive to drying, so more than likely after a few days they will not be able to retain their moisture and will die. But they can be, moving around long enough to attach to a human being. And the other thing about ticks is that they are really
hardy.
They're hardy and they're amazing creatures. Did you know that ticks can sense carbon dioxide gradients?
I knew that. They hone it, and that's how they know where you are. You walk by,
That's right. It's incredible, but they can sense carbon dioxide. In fact, Derlin Fish, who was a medical entomologist and colleague of mine, would tell me that one way that they would collect ticks over by the medical entomology laboratory, they'd put up a block of dry ice out on the driveway, and the next morning they would see the ticks congregating on the traps, CO2 traps.
Oh, God, I don't want to be around for that, I'll tell you. So now these ticks, people think only come in the summertime, and I guess everybody's aware of the fact that the really very serious months are June, July, August, and September, because of how the 2-year cycle of the tick's life. Right. The life cycle, but the thing is they're also here in the wintertime as well.
That's right.
On warm days.
These ticks survive year-round. It's to the best of my understanding, if there's snow on the ground and it's cold enough, it's below freezing, you really don't have much to worry about. But if there is a thaw, even in the middle of January, and the temperature goes up to the 40s and you start walking in the woods, these ticks become active again. And in fact, you can contract Lyme disease practically any season of the year, although obviously it's more common when the nymphs are very active.
You're not wearing as much clothing as also. Your feet are often barefoot or without socks.
Right, and people out of doors more. So
you should see when I go outside now, because I've learned the hard way and wear long pants and 90 degrees, but I just don't want to be infected again.
Well, the fact of the matter is there are things that people can do that really can greatly reduce the risk of one or one's family acquiring Lyme disease.
Such as?
Well, number one is personal protection, barriers such as you suggested with clothing, but in addition to that, there are sprays, permethrin-type sprays that can be sprayed on the shoes, socks, and pants, and these do not repel ticks, they just kill them. And that can be very effective in protecting people who have to go out in areas where we know that ticks are present.
Now, that's easily purchased in Connecticut.
Yes, it is.
I know it's not available in all states, but in our state
in New York, it was not. The DEC in New York had not approved it until recently. I think within the last 6 months or a year, it's been approved in New York. There's a product called Permanone, which is you can get in Connecticut. There's another product called Bonide, which is basically the same product, which you can order directly from the manufacturer. But these are valuable, and also, although it is controversial whether or not to use insecticides. There have been several very good studies done by several different groups of entomologists demonstrating that perhaps 1 or 2 or maybe at most 3 applications of certain acaricides or tick-killing insecticides at the right time of year can dramatically reduce deer tick populations on
your lawn areas.
Right. It wouldn't be suitable for large areas, but at least those areas of your property where you spend time.
Well, interestingly enough, we had Dr. Kirby Stafford come and speak to our support group in Easton, and he said, I thought I heard him to say that it's really mandatory that a person be very wise to spray one of those insecticides around their immediate property and in between the buffer for where the manicured lawn becomes the brush. That's the edge. He said within 1 meter is where most of the ticks are living.
If you want to significantly reduce your risk of acquiring Lyme disease, it is a rational and I think a safe thing to do. Whether you want to use insecticides or not is a personal choice, and some people, have very strong feelings against insecticide use. Personally, from what I have learned about these insecticides, they're generally pretty safe, and you have to weigh that risk
against the risk of
Lyme disease, which can be become a very serious illness.
It can be a lifetime problem that I don't think everybody's willing to accept. It can be a lifetime chronic problem. Now, one of the things I notice, I wonder if you could speak to, is some people seem to get bitten by ticks, and it doesn't seem to make much of a. It's a very individual disease, and it's everybody's case of Lyme disease. It seems to be individual.
I think that's why there's so much controversy. People who have had Lyme disease and are fortunate that they are able, their immune system is able to deal with the infection pretty well. They probably can't believe that other people who have the same disease can be as sick as they can get.
Right. They can't.
They can't.
Because they've come and visited me and they didn't believe me. But I couldn't walk for 4 months this year, which you know about, and I was scheduled for surgery. And I'm thinking about all the other people now who are having problems that are being diagnosed as arthritic problems that could be Lyme.
Yes.
Actually, that's what's so worrisome to me.
Well,
what about the testing? I mean, we ought to talk a little bit about the testing and how the diagnosis really needs to be made clinically.
Yes, the CDC says, and they've said for many years, that the diagnosis of Lyme disease is a clinical diagnosis. And the reason it's a clinical diagnosis is that the tests that we have available at the present time are very imperfect, and you cannot completely rely on the tests. I think one should use the tests, but you have to interpret them carefully. There are problems not only with false positives, which has been highly emphasized by certain academicians, but also, I think, even more importantly, the false negatives. That there are many people who have Lyme disease who are not being picked up by presently available tests.
So they're tested, and they're told that their test is negative, so they're told they don't have Lyme disease, and they're not treated.
Correct.
And as you and I know, and many people are starting to know, that Lyme disease does not go away on its own. So if you're infected with it and you're told you don't have it, it will just continue to wreak havoc in your body, and it affects many, many systems.
That's correct. Now, there are people, and there's probably some genetic basis for why some people deal with the infection easily and some people get very sick. It's clear that there's a genetic basis. Some people can handle it and some people can't. There are people who get infected, either have no apparent illness or a minor illness, and even without treatment, their immune system is able to keep the infection in check. Because there are known cases of people who have never been treated, who test positive, clearly have been exposed, and are not complaining of any symptoms.
I think if you came to my town and mandatorily, had a testing of everybody in town, I would even imagine that many, many people in the town would test positive. Not that they'd be symptomatic.
Yes.
Because some people don't seem to become symptomatic from the bite.
That's correct.
They could be bitten, but as we say, it goes the whole gamut. From someone like myself, when I was bitten, my foot became enormous, and it was such a severe reaction. It was so acute that I kept thinking to myself, whatever this is, I've never had a reaction to anything this acute before. Of course, nobody knew what it was. That was the problem.
Right. One of the problems is someone may have, test positive and they've been infected and they're not showing any symptoms. But the thing about this disease, it is a spirochetal disease, similar in some ways to syphilis. And the organism has the potential to remain within a person for the person's entire life. And if they're not treated, we really don't know 5 years, 10 years, 15 years, 20 years, 30 years, 40 years, 50 years, 60 years, 70 years, 80 years down the line, whether there's going to be, someone can be fine now, but they're not treated. That doesn't necessarily mean that a decade or two down the line they might not have some problem.
Well, what about this idea that people say they've gone to their general practitioner and they say, okay, well, you've been bitten by a tick because they might have it removed or they might have seen it. Well, let's wait and see. I hear this all the time from people. The doctor says, let's just wait and see. But if they're going to wait and see, and once they have symptoms, then it's pretty much gone throughout their whole system by that time.
This is an area of tremendous controversy within the medical profession. many physicians feel it is not justified to treat for a bite, just a bite alone.
Right.
Personally, I think it's foolhardy to fail to treat for a bite, because if you wait until symptoms occur, that means the spirochete has had the opportunity to become a more disseminated infection, and we know there's good evidence to demonstrate that the spirochete has the potential to go to the central nervous system within...
Well, I mean, I'm a perfect example of that. I mean, I wasn't treated for 6 weeks. It took 6 weeks until we finally figured out, because I saw all these different doctors who told me I had everything, you know, you've heard the story any number of times, cellulitis, arthritis, a honeybee bite, a spider bite. I went through the whole gamut. And so my thought is, if people are going to wait and see, once they have the symptoms, like my hands became paralyzed, I really didn't have much use of them, and I am a textile artist, and it was really quite a problem for me. It was too late to wait and see. You really can't wait and see.
I think it's... well, the tick bite is one thing. If you have the Lyme rash, then and it's recognized as a Lyme rash,
then you're lucky.
Then it's mandatory to treat at that point. And I have some just incredible stories from my practice of people who went to a physician with a Lyme rash, got tested, the test was negative, and the doctor said, you don't have Lyme disease, and failed to treat the patient. And then a couple of years later, the patient had serious and irreversible injury as a result. It's just incredible.
So some of the symptoms are irreversible then? Some of the problems?
Some of the, you can develop irreversible injury from this disease, yes.
We should tell you a little bit about how one feels. I mean, I know it just runs the gamut. There's just so many different symptoms you can have, but maybe you want to mention a few things to the public about what you see in your practice.
Okay, well, I think most people are familiar with the, you know, the sort of the well-recognized, the rash, the flu-like illness, the sore throat, headache, stiff neck, and later on, joint problems, arthritis, swollen knee, joint damage. There can be heart involvement, and there can be
eyes.
You can have involvement of the eyes. You can have a Bell's palsy, which is a drooping of a side of the face from paralysis of the facial nerve. And one can have a whole variety of neurologic problems, some of which, if treated early, can be completely, reversible. Starting out with meningitis, for example, but running the gamut to really serious neurologic injury that can leave a person with permanent deficits. So that by the time the person gets treated, they already have had irreversible injury.
Well, what happens at that point now? Let's say a person is being treated, then what happens at that point?
What do you mean?
Well, like myself, excuse me, I mean, I've been treated now on and off for 2 years. So now we get into another controversy, is what you do with the patient once we stop practicing denial and accept the fact that the person has Lyme disease and they have a dozen or so symptoms like I had, and then I go on a treatment. And nobody seems to know how long the treatment needs. It's very individualized. Again, how long you need to be treated, with what you need to be treated, and at what quantity.
Right. Well, every patient is different, and I think treatment has to be individualized. But one of the big problems is, and one of the big questions is whether or not we're curing people when we treat them with our antibiotics.
What do you mean by that?
Well, there's considerable evidence accumulating that patients who are treated intensively with antibiotics, that when they relapse, that number one, that they may relapse, and that when they relapse, it's not a post-infectious syndrome, but it actually denotes that the infection still is present.
And then what do you do at that point?
Well, if you believe that the infection is still present, in my opinion, the rational thing to do is to treat further with antibiotics.
So a person could actually be on antibiotics 2, 3, 4 years or whatever.
Yes.
And that is happening.
It is happening, yes.
And other people are very upset about it and say it's just not an orthodox way of treating somebody.
That's correct. It's not orthodox.
But people have been treated for acne with tetracycline for a year or two.
For many years.
For many years. And
Yes.
people are treated for tuberculosis for 2 years.
Yes.
And everybody accepts that. I realize you're running a risk, aren't you, in being treated with antibiotics for long periods?
Anytime a person takes any drug, there's always some associated risk.
But the risk of not treating the Lyme disease, if it's a chronic, is really, from my experience, been a lot more severe, I think.
In my opinion, the risk of untreated Lyme disease outweighs the risk of treatment with antibiotics that are being properly monitored.
Well, the first year that I had Lyme disease, I was told that I was treated, and the disease was already treated, and what I had at that point was arthritis, and I had to live with it. And they told me that I was told by several doctors, not just one, that what I had in effect was post-Lyme syndrome, they called it. In other words, my body was in a tailspin, my immune system, and that in time it would take care of itself on its own. And I was told to take anti-inflammatories or Advil, exercise, eat well, sleep, and all those other things that people need to do to build their immune system. However, in my case, a few months later, I couldn't walk on my left foot, and then that situation became to the point where I was debilitated, and nobody recognized it as Lyme disease or as the continuation of the same infection.
Yes.
And now that I'm in treatment, as you can see, I'm able to function again. So I'd like you to just talk to the audience a little bit about what you found that, speaks to post-Lyme syndrome.
Okay. In my opinion, the post-Lyme syndrome is a myth.
A myth.
There is not a post-Lyme syndrome. Or if it is post-Lyme, it really is a result of persisting infection.
Persistent infection.
But, I mean, I guess I've had a rare patient with Lyme who has had continued symptoms in whom further treatment with antibiotics really did not accomplish much. And if that's the case, then you really do have to conclude that they do not have an active infection. But in my experience, the overwhelming majority of patients who continue to have symptoms following what is supposed to be adequate treatment for Lyme disease,
about 2 months or whatever it used to be.
It varies. I mean, some people only recommend 10 days, 2 weeks, 3 weeks.
I thought it was at least 6 weeks that they were saying.
The orthodox approach is that greater than 14 to 21 days of antibiotic treatment is not warranted or justified. Recently, some of the academicians have been saying, well, maybe a month of IV antibiotic may be adequate. But it is clear, in my opinion, that they are wrong. They're just flat out wrong. And many responsible investigators, even in academia, are coming to the same conclusion. There's good work that's being done at Tufts by Dr. Klempner, which has been able to demonstrate that the Lyme organism is an intracellular pathogen. That means the Lyme organism is able to actually get inside of cells, particularly fibroblasts, which are the cells that produce connective tissue such as skin, tendon, and whatnot. And not only that, but they were able to treat tissue culture that had been infected with Lyme with the same kind of antibiotics that are used to treat intravenously for Lyme disease. They treated the tissue cultures for 2 weeks. Then they washed away the antibiotic. They treated the tissue culture to break open any cells that were living, and they were able to recover spirochetes that obviously that they felt were sequestered within the cells. So this helps to explain how it's possible that an organism can survive aggressive antibiotic treatment with what, for most kinds of infections would certainly eradicate the infection. But these organisms have the capability of surviving in sequestered sites inside of cells where antibiotics are not able to eradicate them.
Because you can be infected more than once. That's another thing people have to understand. You can be bitten, infected, and treated, and then you can be bitten many times again. That antibody that your body builds does not protect you from another infection. In fact, people in my town talk about the years according to when they were. They say, I was bitten in 1987, then in 1989, then in 1991. So some people the tick just likes, right? It seems there's something about them that seem to get bitten, and maybe their husband doesn't. But in some families, there's husband and wife. Many members of the family have Lyme disease, which is really devastating.
It can be very devastating when multiple family members are sick. It can really impact on a person's ability to earn a living.
Oh, Dr. Liegner, you just don't know. Also in the relationship in the family between the husband and the wife. When one person's sick all the time, it's really not very pleasant for the people who are well. It's upsetting. more than that, the whole family structure seems to just start to come unwound,
Absolutely.
and it
I
really
think
has
I
far-reaching
think there have been
problems.
families that have broken up
there
over
have
Lyme
been.
disease. Yes.
And I've heard about it through, just the Lyme support group. You hear about it. And also it's very upsetting for people who go and have surgery, such as I was scheduled to have, on their knee or their foot or whatever, and if it's a spirochete that's causing that problem, that surgery is not going to resolve the problem.
That's correct.
In fact, it's going to take longer for that person to heal from that surgery. Then they have to find out again what's
Right.
the core of this dilemma they're in.
That's correct.
All right, so the vaccine is going to happen.
Connecticut, which is developing the vaccine, has made a lot of progress. It still looks like it's going to be several years before it's going to be available widely for patients. I think they're going to be doing some clinical trials within the next year or so on patients living in a Lyme endemic area. Right now, it's been trialed in New Mexico, not to see whether it is effective, but just to make sure that the vaccine is safe and doesn't cause problems for the patients, for the people who receive it. So far, it seems to be pretty safe, and it seems to be quite effective in mounting an immune response.
But there's no vaccine then this summer or next summer.
No, it's going to be probably at least 3, 4, 5 years.
And a worrisome thing is when your college students come home to visit, or guests or people coming to visit you in the country from the city, they wouldn't be so aware of this. And we don't want them to be scared. We just want them to be aware. Because then they go back to the part of the country that they're from, and it might not be such a problem in that part of the country,
Right.
so the doctors there might not recognize it.
I think it is always helpful to be informed, and with that you can at least protect yourself.
Well, testing. Okay, now I heard you say the Gunderson test you feel is going to be more
Well, the
success-
Gunderson test is a fairly new test. It goes about diagnosing Lyme in a somewhat different way than the standard antibody tests. The standard antibody tests depend on there being free antibody that you can detect, and based on the intensity of color reaction, determine whether it's positive or negative. The Gunderson test is also a certain kind of antibody test, but it's more what's called a functional assay. It detects antibodies that are so-called killing antibodies. The way the Gunderson test was developed was that we know that in syphilis there's a very time-honored test called the TPI, that stands for Treponema pallidum immobilization assay. It reacts a syphilitic patient's serum with a strain of the syphilis organism. Spirochetes normally are motile; they move about, and
you don't have to tell me. I could feel them moving about. I really feel them. It's like little Pac-Man in a way, not in a good way. So what we're saying is there's a better test than there has been, maybe.
Well, let me just finish
right,
it.
okay.
So the TPI is a very honored test for syphilis, and it depends on the serum of the syphilitic patient immobilizing the syphilis organism. It makes it stop in its tracks. Steve Callister, who's at the Gunderson Foundation in Wisconsin, figured, well, if that test works for syphilis, which is a spirochetal disease, why don't we try to develop a similar assay for the Lyme disease organism? And in fact, that's exactly what he did. And he's done quite a bit of validation work to demonstrate that you don't get false positives, and that not only if the test is positive, not only does it indicate that the person has Lyme, but it seems to be a very good indication of active infection. In other words, people who get treated for Lyme and get cured, the test does not remain positive. So it's one of the few tests that we've had available that can give us a clue whether the person still has active infection.
So this is a blood test.
Yes.
So I can make an appointment to have that done soon?
Well, the person has to be off of antibiotics for a period of time.
Okay.
Because if you're on antibiotics, that will also immobilize the spirochetes. So you have to, depending on the drug, you have to be off at least a couple of weeks.
Well, we've run out of time, and I'm so sorry that we have, because all this information is of such importance to everybody living in Fairfield County and Westchester County and all over the United States, actually. But I think maybe it'll help shed some light, and everybody please be aware, pay attention to your children, keep socks on. That's what I say. Keep socks on in the summertime. If you're going for a walk or a hike, please spray your clothing or yourself. And just be aware and get to your family doctor if you feel that there's some question that you might have been bitten, Dr. Liegner.
Thank you very much.
Thank you thank you more than so much.